In a world where carbs are your enemy, you need one man to help you fight your battles. That man is Jimmy.
Combating nutrition disinformation and general bull. It's Jimmy Rants. JimmyRants.com.
You've been looking for a quality brand of CBD oil and didn't know where to turn? Let me introduce you to Botan CBD. Go to botancbd.com, that's BOTAN CBD.com, and you'll see a full line of CBD oil products. The benefits of CBD oil are plentiful, including pain relief, anti-inflammation, mental clarity and focus, stress and anxiety reliever, and the list goes on. I've been using Botan CBD oil on my sciatica pain, and it makes it disappear. You can rub it on the body or take it orally, and you can trust that Botan CBD is the highest quality CBD oil on the market. They are a pharmaceutical-grade organic CBD, small batch, and handcrafted for you. Head on over to botancbd.com and use the code Jimmy at checkout for 15% off your first order. Live life well. Botan CBD.
What's up, you guys? Welcome back to another Instagram Live, and we're here with another episode of Jimmy Rants. JimmyRants.com is the website, and here's how the fun begins. I start off over on Instagram. You gotta go follow me there. I'm at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, you can engage live with me, and I do love all my Jimmy Rantsers that follow me there on Instagram. We also simulcast live here on Facebook Live, so thanks to all my Facebookers for being here as well for this episode of Jimmy Rants. Over here on Instagram, if you missed the live, then you need to watch it on replay, and you get up to 24 hours to do that on replay on Instagram. After 24 hours, it does disappear, so you'll need to see all the past episodes over on YouTube. We house them over there. Just type in a keyword, Jimmy Rants, either in a Google search or a YouTube search. You will find the show. It's also youtube.com/livinglowcarbman. Finally, the best of the best moments of this here show are in podcast form. It's the Jimmy Rants podcast over on Apple Podcasts as well as Stitcher. All of these links, you guys, are at jimmyrants.com. Today's Jimmy Rants is all about another one of those analyses that is taking a look at the cost effectiveness of making changes in our culture. So for the longest time, people have complained that they haven't eaten healthier in their diet because all of the health foods that are out there to consume just cost way too much money. And so I know with the food stamps program, one of the things that they have tried to do to incentivize people to buy healthier foods with the food stamps is they end up like doubling their value if you use them, for example, at a farmer's market. So farmers markets are using this as an incentive to get people to buy healthier foods. I know my local one here in Spartanburg, they do that. If you're on food stamps, you can show them your food stamps, and then they give you back double the value in bucks that they can spend at the farmer's market. And ostensibly, they're spending it on good quality foods, fruits, vegetables, quality meats, those kinds of things. So that's a good step in the right direction. But what I want to talk about here today is when we start subsidizing what I'm going to have in quotation marks, healthy food, it will improve health, yes. But who gets to define what healthy food means? Because I think this is the debate that's happening right now. Everybody knows that people should be eating healthier food. The problem is there's no consensus on what healthier foods mean. We can almost generally recognize the unhealthy foods. So trans fats, unhealthy food. Refined carbohydrates in the form of sugars and grains, unhealthy foods. Generally, those things, sugar, unhealthy foods, those things are all almost universally agreed upon as unhealthy. But what do we agree upon is healthy, universally across the board with everybody? If you ask a vegan, is meat healthy? They're going to tell you no. You ask a carnivore, is meat healthy? They're going to tell you absolutely. You ask a vegan, for example, can you have soy? And is that a good quality food for people to be consuming? They're going to say absolutely. You talk to someone who has problems with the estrogenic effects of soy, whether they think soy is healthy, and they're going to tell you no way. So there's a little bit of kind of discordance about what healthy food actually means. And I bring all of this up here today because I have a headline out of the NIH. So that's the National Institutes of Health. And they have published a study, you guys. Headline, prescribing healthy foods could bring cost-effective benefits. And in this study, they're encouraging, let's subsidize those foods that are deemed as healthy, which would encourage people to make better choices in their diet, and then by extension of that, make better choices so that their health would get better and we lower the overall cost of health care. So let's read what they had to say. A sophisticated model estimated that healthy food subsidies could save billions of dollars in healthcare costs, as well as prevent hundreds of thousands of heart disease deaths, as well as diabetes cases. These findings suggest that a cost-effective way to improve health is to prescribe healthy foods. Your diet plays such an important role in your health. An unhealthy diet is one of the leading risk factors for cardiometabolic diseases, things like heart disease, stroke, and diabetes. Eating a healthy diet can lower your risk for some of these conditions. A healthy eating plan includes vegetables. So this is where they define what they think healthy is. Vegetables. Okay. The problem when you use just such a broad category like vegetables, that includes everything. Not just like non-starchy, green leafy, but literally every vegetable. If they can plant it and grow it and they're calling it a vegetable. Are starchy vegetables the same as non-starchy vegetables? No, but they just say vegetables. Fruits. So fruits are kind of a love-hate relationship. People love them. Oh my gosh, they're so healthy, and people just gobble them down. I know people that eat several bananas every single day. Oh, it's healthy for you. I'm like, yeah, you just got 29 grams of sugar per banana. And people don't look at it in that way. They just look at, well, it's healthy. And according to this new study, that's part of what's considered healthy foods. A ketoer can't say that fruit is necessarily healthy. Not that all ketoers can't eat fruit. Some of us can have berries, which is the lower end of sugar on fruit. But most of us can't have bananas. One banana is already too many carbs in the day. Whole grains is the next one. How does whole grain still survive as a health food? Anybody, can you help me out with this one? With all that we know about the damaging effects of whole grains, the anti-nutrients that are found in whole grains, the basically every bit of negative parts of your diet happen because grains are in them, grains and sugars. And so whole grains, about the only thing they can hang their hat on is whole grains do have fiber. But I would say that the fiber that's in whole grains ain't very good for you either. It's going to irritate the gut lining of your stomach, and it's no bueno. So if you're just joining us, we're going over a new study, and I'm about to share the team that did this study that is talking about prescribing healthy foods, how that would be a cost-effective benefit to saving billions of dollars in healthcare costs, and also preventing hundreds of thousands of deaths and cases of heart disease and diabetes each year. The problem is, and what we're talking about here today, is subsidizing healthy food. Yes, we agree, will impact your health and improve it. But who gets to define what healthy food means? And we're going over what they think healthy food is. So far, vegetables, fruits, and whole grains is what we've stated. Next up on the list, fat-free or low-fat dairy products. So we're still stuck on the fat phobia. What is the value of removing the best part of dairy products? And the best part of dairy products is the naturally occurring fats in it. What benefit do you get in your health by removing these fats that are totally there for a reason? I've never understood how a real whole food like raw milk, for example, is somehow unhealthy for you because of the fat in it. But then we put it through this homogenization and pasteurization, and we strip out the fat from this real whole food, and then we call that a health food because it's skim milk, or we call it a health food because it's 2% milk, or low-fat cheese, and all of this stuff. For me, this is disgusting, because why take away the one good part of dairy? And to me, dairy fat is the best part of the dairy. Lean meats is the next one. What's wrong with fatty meats? Guys, the fat phobia in our culture is so strong. And to get articles like this one that come out that just keep reinforcing this. And I was telling the story on last night's Jimmy Rants about talking to this lady in the bank yesterday. And she said, I tried that keto and I didn't do so well. And then I tried to egg her on a little bit to figure out what happened, because I knew what happened, but I wanted to see if she could articulate it. And the first thing she said was, I know I'm not eating enough fat in the diet. And I'm having too lean of meats. So people know, they're just still so scared half to death to eat anything but lean meats, because by golly, that's what all these studies, what all these health professionals have told us to do for so long. It's hard to get that out of your head that that's not necessarily the right thing. Forget lean meats like chicken and turkey and all of that. How about fatty meats, like a ribeye steak? How about a good fatty ground beef? These are the things we need to be telling people to eat. Oh no, that's saturated fat. Someday, you guys, someday they'll get it. Poultry, that's a healthy food. So again, the fat-free chicken breasts. Do you know how many people have eaten chicken breast at the altar of its health food? And to me, I think chicken breast is one of the least healthy foods you could possibly put in your mouth. If you are eating a ketogenic diet right now and you eat chicken breast on a regular basis, if you want to have one every once in a while and doctor it up and all that, that's fine. But chicken breast is not health food. Chicken breast is all protein. And when I consume a protein source, I need it to be as fatty a protein source as possible. And yes, I know you can add exogenous sources of fat. But as I've stated before on Jimmy Rants, the amino acids that are specifically in chicken can be problematic to your insulin levels. And I've seen this physically myself in insulin going up pretty significantly over a short period of time after having chicken breast. And so if we know it raises insulin, what are we trying to do with keto? We're trying to lower insulin. So yes, they want to talk about lean meats and poultry and being healthy for you, but they're really not doing your body any good. Fish is healthy. Okay, I agree with them on that one. Eat fish. The fattier the better, but fish is healthy. Beans. See, beans get this nice little health halo too. Oh, they're full of protein and fiber. Yes, they are. And they're full of carbohydrates too. They pretend like there's no detriment to the carbs that are in things like beans. Now, green beans is the exception. You can have all the green beans you want. that ain't the kind of bean we're talking about here. We're talking about like kidney beans, white beans, all of those, the starchiest kinds of beans. Mama used to make all kinds of beans, white beans especially, for us, and we ate it. We ate it because there was the perception it was healthy. And it did have protein, yes. It did have fiber, yes. But it also had a ton of carbohydrates. And if you have blood sugar issues because you're insulin resistant, that's no bueno for you. I can't believe they put this next one down, but eggs. Because usually when they mention any kind of egg product, they always mention as part of healthy foods, egg whites, but not the yolks. But they put down eggs, to their credit. This is another one. This is probably the one I strongly agree with them about as a health food, eggs. And so make sure you're eating the whole egg. Don't just eat egg whites. If you make 5% of your diet egg whites, which a lot of women, especially younger women, typically do, there is this anti-nutrient in egg whites called avidin. And avidin, if it gets to 5% of your diet, total number of calories, which it wouldn't take that much. If you eat a low-calorie diet and then you're having like 5 or 6 egg whites, you could get to 5% of your diet coming from egg whites. And the avidin actually causes some birth issues. It challenges being able to conceive a baby, which is why some women tend to have fertility issues in their 20s because they're eating all these egg whites. And the last one is nuts. I agree with that one as well. The caveat I'll give on nuts is try to make them raw nuts, so raw almonds, and those kinds of things, and make sure they're nuts. Peanuts are not a nut. Peanuts are a legume. No bueno. And make sure if they're roasted that they're not roasted in soybean oil, cottonseed oil. This tends to be the standard of nuts. So when you buy it in a grocery store or in a convenience store, or, Walgreens or something like that, be aware that most of the ones on the shelf that are roasted are going to be roasted in really inflammatory types of oils. So avoid those. Try to get raw. They sometimes call them whole almonds. Macadamia nuts are naturally whole. The peely nuts are one of my favorite ones, and they're the most ketogenic nut, something like 22 grams of fat per serving. And they're roasted in coconut oil. So pretty cool. All right, so continuing, that's all the list of the healthy foods. The unhealthy foods that they say you should limit in your diet include sugar, salt, and fat. So don't eat sugar, salt, and fat, not in any kind of quantity anyway. So, yeah, this is crazy, guys. Who gets to define what healthy food is? To me, I think we need to have some kind of independent party that decides what's healthy for specific situations. If you have insulin resistance, here are the list of healthy foods for you. If you're relatively insulin sensitive, here are the healthy foods for you. If you have type 2 diabetes, I think they need to make it condition dependent. Because if you don't do that, you leave it to the devices of what people will define in their own minds is as healthy. Or they'll define it for you in research like this we're reading here today, and it could be all wrong. If I ate a diet full of indiscriminate vegetables, fruits, whole grains, fat-free, low-fat dairy, lean meats, poultry, fish, beans, eggs, and nuts, I would balloon up bigger than I've ever been in my life. I would have type 2 diabetes because I couldn't stop the uncontrolled blood sugar and insulin response that would come from this. I would be highly, highly inflamed in my body. I would not do well on this kind of healthy food diet, even if they subsidized it to the hilt. And that's the question at hand here today, is subsidizing healthy food is a good idea to help improve health, but who is actually defining what that means? Prescribing healthy foods is one potential approach to lower heart disease and cardiometabolic conditions. However, it hasn't been well established whether this would be cost effective or help lower the disease burden. Oh, it hasn't been well established either that all of these dictates that were just outlined that I just shared with you about the healthy foods, it hasn't been shown in any study that those foods actually do anything good for your health. So they can pretend like that they have the answers and pretend like that, oh, well, let's implement this and watch everybody get healthier. What's the unintended consequence? People follow this to a T. And to me, you guys, a lot of the things that are in that list, we have had prescribed to us through the U.S. dietary guidelines for Americans. We have had eat more fruits, eat more vegetables, eat more whole grains, eat low-fat and fat-free dairy, eat lean meats. We've had all of this in the dietary guidelines. Have we gotten thinner? Have we had less heart disease? Have we had less type 2 diabetes? No, we have not. So what makes them think that this failed prescription of a list of healthy foods that they think is going to provide all these benefits, what makes them think it's magically going to start working now when this diet and this way of eating and these so-called healthy foods have never worked ever before? So the research was led by doctors Yujin Lee, Dariush Mosafarian. I know Dariush's work. Dariush is the one that talks about making sure that you get a breakfast, and those who eat breakfast every day end up eating less calories later in the day than those who skip breakfast. That's kind of his claim to fame type of work. And he has been out there for many years trying to push people to eat all of those foods that we just talked about earlier. And Renata Misha at Tufts University, as well as Dr. Thomas Gaziano at Brigham and Women's Hospital. So what they did, you guys, here's what they did in their study. They simulated the health and cost benefits of food prescriptions using data from this study called NHANES, NHANES. That stands for National Health and Nutrition Examination Survey. They modeled the potential outcomes. So here's what they did. We know all these foods are going to lower diabetes. We know all these foods, if people consume them and we help subsidize them so that they actually eat these foods, we know it will reduce deaths by heart disease. So they're already putting in their preconceived notion about what these foods will be doing for the people. What they didn't take into account is, what if people have an adverse reaction? What if people have higher blood sugar and insulin levels and develop type 2 diabetes? What if they get heart disease because of the increase in inflammation from these foods that they're subsidizing? They didn't put that in their model. Surely there will be some people who won't respond well to what they think is a healthy diet worth of those foods that we talked about a moment ago. And so keep that in mind as I read this data. So they modeled the potential outcomes for including healthy food incentive policies. They're going to do it through Medicare and Medicaid, which cover about a third of the U.S. population. The research was supported by the NIH's National Heart, Lung, and Blood Institute, and the results were recently published in the March 19th, 2019 issue of PLOS Medicine. So that's a medical journal. So here's what they did, you guys. The team modeled 2 food incentives, a 30% subsidy for fruits and vegetables. So they get a 30% discount on all fruits and vegetables. And then they also did a 30% subsidy on healthy foods in general, which included fruits, vegetables, whole grains, nuts, seeds, seafood, and plant oils. When you hear plant oils, don't necessarily go to olive oil, avocado oil. Think seed oils, vegetable oils, which has never had a vegetable in it. All of canola oil, corn oil, all of those things that you guys, you've heard me rail about it before. Those are some of the worst fats you could possibly put in your mouth. They want to vilify saturated fat. The real enemy fat in your diet is all of these so-called healthy fats from vegetable oils. Stay away from them, stay away from them, stay away from them. That lady at the bank the other day, I asked her if she ate mayonnaise. Oh yeah, I love mayonnaise. What do you use? Oh, I use this one. It's got avocado oil in it from Kraft. And it ended up being mostly soybean oil. And she had no idea. She thought she was getting avocado oil. So you're getting more than you bargained for. Using the NHANES data from adults on Medicare and Medicaid, the researchers built a computer simulation that estimated the health and economic benefit of these kind of programs, the 30% subsidy, over 5 years, 10 years, and 20 years, and then over the entire lifetime of the study participants. If the fruit and vegetable incentive was carried out over a lifetime, the model estimated that the average consumption of fruits and vegetables would increase by 0.4 servings per day. So currently they're having 1 apple, and this subsidy will now enable that person to eat 1.4 apples. That's what the model is showing. Is that really helping people, giving them that little bit of a extra boost in? If you have an extra, let's just say half of an apple, is that going to prevent you from eating a candy bar later? No. Weird. This would also prevent about 1.93 million cardiovascular disease events, as well as saving $39.7 billion in healthcare costs. You know what this sounds like to me? This sounds like those people that put together business plans. Oh, if you invest now, give us $10,000, and here's how your money will grow. We'll put it in this and this and this, and then 1 year estimates, 2 year, 5 year, and it's just astronomical. Your $10,000 will turn into $1 million in less than 10 years. And then you get about a year into this, and the company folds. And what happened to your $10,000? So what happens if we get into this model and we pretend like it's going to do all these benefits, but we get 1 year into the model and we're not seeing 1.93 million cardiovascular disease events prevented? What if we see an increase? What if we see, instead of saving $39.7 billion in healthcare costs, what if we see an increase of $10 billion in healthcare costs, with people eating what they think is the ideal healthy foods? I don't think they're taking into account the metabolic disturbance that so many people have. And so this could potentially, because guys, these kinds of studies is what shapes public policy, is what gets things moving when it comes to incentivizing people with subsidies and things through the government. They're going to look at research like that. Well, they show, the models show we're going to save this much money and we're going to have this many less heart disease events, when there's no way they could possibly know that. The model predicted that the generally healthy foods incentive carried out over a lifetime would increase fruit and vegetable intake by that exact same amount, that 0.4 servings per day. It would also increase the average consumption of whole grains by 0.2 servings per day. 0.2? So if they're doing the recommended amount of servings of whole grains now, let's just say they're getting in like 5 servings of whole grains. 0.2? We're talking about 1 more serving. 1 more. So is there a measurable difference between 5 servings and 6 servings? I don't think so. Nuts and seeds would go up by 0.1. I mean, you might as well statistically not even count that. 0.1 is so insignificant. Seafood would go up by 0.2 as well. Plant oils by 1.5 teaspoons. This, they say, these just nominal little bitty changes would prevent 3.28 million cardiovascular disease events and 120,000 cases of diabetes, saving $100.2 billion in health care costs. Again, how can they even possibly think that that's going to be anywhere close to true? I'm not buying it. Are you guys buying this? I'm not buying this. The lead researcher says our findings support implementation and evaluation of healthy food prescriptions within healthcare systems to improve the diet and health of Americans. The problem with this is the people that are involved in healthcare, doctors, nurses, all the people that are involved, physicians, assistants, PAs, all of these people, all the specialists, none of these people have been trained in nutrition. They have no education to speak of when it comes to nutrition. And now suddenly we want them to be evaluating what healthy food is, using it as a prescription for improving the health of their patients. I wonder what the pharmaceutical industry is going to think about this healthy food prescription. And while I'm no fan of pharmaceutical companies and the drugs they peddle that are totally unnecessary, trying to mask the symptoms of bad diets, I don't think they're going to be too happy about this. Because while, yes, I'm glad they want to try to make a food solution rather than having a prescription drug solution, I think the answer has to be something that's actually going to produce good health outcomes. And this ain't it, you guys. And if we're going to put unqualified people in charge of prescribing healthy food, your family doctor does not know what healthy food is unless he's gone and done training on his own outside of his medical school training. I've been to some of these medical conferences, you guys. They don't talk about nutrition. And in fact, the nutrition they serve at like the breakfasts and lunches at these places, you don't want to know. It's like pastries and donuts and cookies, and it's just nastiness that they serve at these medical conferences. So is that the person that thinks that's okay to serve at a medical conference? Is that the kind of person you want to trust with diet advice for you and to prevent disease in you, heart disease, type 2 diabetes? I don't think so. These new findings support the concept that food is medicine, that innovative programs to encourage and reimburse healthy eating can and should be integrated into the healthcare system. Well, that might be true, and it certainly is a dream that we go back to food is medicine. But it comes down to this, you guys. The bottom line in this Jimmy Rants is nobody is against subsidizing healthy food as a means of trying to bring about better health outcomes. My question and my biggest concern in this discussion is who gets to define what healthy food is? Because if we disagree with what they think is healthy food, what recourse do we have? What, as a keto carnivore dieter, could I say to them to get them to incentivize me buying grass-fed beef and grass-fed offal, having beef heart and beef tongue and all of the little odd bits, liver, those kinds of things? Are they going to help subsidize those things? There's a lot of you guys that are on a tight budget and you don't have extra money to spend on good quality foods like meats. Wouldn't you like to have an incentive that would be subsidized to be able to pay and afford to pay for grass-fed meats and pastured eggs and things like that? Sure you would. And if they truly want to see all those health outcomes in that model that they've described here, I think they need to get their priorities straight and come up with a better way to define what healthy food means before we roll this out and then we quickly find out what a disaster their definition of healthy food is. All right, let's see what you guys have to say. We'll come back to you guys. Hey guys, we got knocked off of my Jimmy Rants. I was just giving a long Jimmy Rants, not long, but I guess half an hour worth of my Jimmy Rants, and the storms that we're having here. We're having major storms here in South Carolina today, so that kicked me off, you guys. I apologize. Gonna let you come on back in. Sorry about that, guys. Yes, my Wi-Fi got frozen, so I had to get off of the Wi-Fi. I'm now on the LTE on my phone, so I actually totally lost it over here on Facebook. So come on back in, guys. I would love to engage what you had to say. Unfortunately, all of the things that you wrote down there to my Jimmy Rants are gone. So if you will comment somewhat on what you think about this idea of healthy foods, come on back in, guys, and give me your comments. I got kicked off. We've got major kind of storms here today in the South Carolina area. So my apologies, we got kicked off. I definitely want to engage with you guys about what you thought about this idea of prescribing healthy foods. So please type in your comments. I got kicked off, as you saw. And so please share your comments. And what can we do about the 2020 guidelines is saying keto, Bob. So yeah, the 2020 dietary guidelines are going to be an interesting one, keto Bobs. I think we're going to see a regression of the dietary guidelines. I don't think we're going to see progress being made. I think all of the good that happened in the 2015 dietary guidelines is actually going to be a little bit undone. Like they said in 2015 dietary guidelines that cholesterol would not be a nutrient of concern anymore. And so the sale of eggs and other cholesterol-rich types of foods have gone up. Well, there's people that aren't too happy about that. And so they're going to do things probably to vilify eggs again. And we've already seen it. I did a Jimmy Rants a couple of months ago on that study that talked about eating 3 eggs will cause heart disease and early death. And so we're already kind of seeing the ramifications. And I think with all the things that are happening in our culture, trying to push us all towards more a plant-based diet, that's kind of going to seep into our guidelines. So what do we as good people do about it? I think we just keep living our lives and we try to educate the people within our lives. I don't think you can really do anything about the dietary guidelines other than tell people and educate people how wrong they are. And it's unfortunate that it has to come down to that. You would think they would stay on top of all the latest and greatest science when it comes to nutrition, but unfortunately that is a ruse that people believe regarding the dietary guidelines. They simply aren't based on good science, not all the good science anyway. So if you're just joining us again, yes, I got kicked off after doing my Jimmy Rants all about prescribing healthy foods, and I was asking you guys the question of how do you define healthy foods? Who gets to define it? I'll go ahead and repost my pin post so you guys can see what we were talking about. But yes, it was a great Jimmy Rants, and then suddenly we're having bad storms here in South Carolina. It kicked me off. So my apologies. If you had great comments listed below, please write them again down there in the comment section. I definitely want to engage with you guys on this. Elizabeth says, what do you think about the carnivore diet? Well, Elizabeth, are you following me, my dear? I have been doing keto carnivore since the beginning of January. And I think carnivore, quite frankly, is the next big trend. So keto is kind of all the rage right now. I think the next big trend in nutrition is a carnivorous, animal-based kind of diet, which when that happens and it hits big, you guys, I think the vegans are going to have their minds explode, because the antithesis of what they're trying to teach people is to eat no meat. And then you've got people that they only eat meat. I think it's pretty spectacular. I do think for some people that carnivore is not enough, so they add in the keto element, and all that means is you're bumping up the fat just a little bit. For Jimmy Moore, for example, about a 75 to 80% fat is maybe 10% higher than what a typical carnivore diet would be. But that's worked for me. So yeah, love the carnivore diet. AK Bonbon doesn't really sound much different from what they want us to eat now. Exactly. That's the thing, AK Bonbon. They want to pretend like if we only subsidized all these healthy foods, people's health would get incredibly better. But you're exactly right. How, pray tell, is it different than what they have recommended with the dietary guidelines for Americans, for example? That's exactly what they've pushed on us. Eat more lean meats and low-fat dairy and whole grains and legumes and all of this stuff and beans. How did that work? Have we gotten healthier? Has obesity gotten better? Has heart disease rates gotten better? Do we have less type 2 diabetics now? No. It's worse than ever before. Now, I'm not laying that at the feet of this so-called healthy diet because most people aren't eating that. They're eating crap. But this is what begs the question. If the, quote, healthy foods are undesirable, that people can't sustain that kind of diet, this is a whole nother discussion about why a ketogenic approach might be helpful. Because ketogenic, yes, is hard at the beginning, but I would argue a ketogenic diet is far more sustainable than this kind of diet that they're calling for. Fruits, vegetables, whole grains, fat-free, low-fat dairy, lean meats, poultry, fish, beans, eggs, and nuts. If I ate the last part of that, poultry, fish, beans, eggs, and nuts, it might be good, but it's that first part, the indiscriminate vegetables, fruits, whole grains, and fat-free, low-fat dairy, and lean meats that has me going, what? So, yeah, we're gonna be in trouble if this becomes a thing. And I appreciate that they're trying to incentivize food as medicine, but this ain't the way to do it. This certainly ain't the way to do it. If you came back in after getting kicked off, yes, I got kicked off. We're having major storms here in South Carolina here today, so my Wi-Fi just totally went off. I lost everybody over on Facebook Live. They're like, Jimmy, where'd you go? So I got on the LTE service here on my iPhone to answer the questions and give you guys a chance to feedback. It was so funny because I had literally just finished the rant, and then I was going to you guys to get your comments, and poof, it just disappeared. I was like, crap. Grandma Does Keto, especially infuriating after the big request for input. Well, Grandma Does Keto, they have requested input ever since I've been online. When I first came online in 2005, they were setting the guidelines for that year. Then in 2010, I went to Washington, D.C. and testified before the U.S. Dietary Guidelines Committee, Advisory Committee. And yes, they always open up comments online. Can I just tell you, it's such a big, fat waste of time. You could put all of the anecdotal stories about how keto has changed your life in there. You could talk about and list for them research paper. They're not looking at that. They don't care about your puny little butt telling them what they're the wizards of smart on nutrition should be looking at and doing about nutrition. It's a ruse. They want you to think that they're being very scientifically valid and vetting out what all the latest science is saying when it comes to nutrition, when they're doing nothing of the sort. They're simply not. And so we've got to get out of this mentality that our input matters. It doesn't. When I testified in 2010, did my input matter? Did they make any major change? And oh yeah, by the way, what I told them was we need a multiplicity of different kinds of nutrition plans for different circumstances. And I said, it's just like we don't all wear the same shoe size. We need different plans for different people to choose from. So have a low-fat plan, have a vegan, vegetarian plan, have a keto plan, have a paleo plan, have a Mediterranean diet plan, have all these different ones, equally make them look good in a positive light, all of them, and then say, okay, choose. Which one would you like to do? And maybe even offer up some kind of test to figure out which one would work best for them. So do you tend to have higher blood sugar? Okay. Do you tend to, when you go to see the doctor, have fasting insulin levels that are above this amount? Okay. Do you have abdominal obesity? Okay. And then, Oh, okay. Well, we now realize keto would probably be pretty good for you. Do you have a great response to blood sugar to the foods that you eat? Yes. Do you have minimal insulin when you have fasting insulin? Yes. Oh, okay. Well, here are the options. Maybe Mediterranean or vegan or something like that could be right for you. Make it where everything looks good. I think what has gotten us into trouble in the nutritional health space is when one way of eating has been vilified to try to make other ways of eating look good. And that's what's happened. And that's what they're subtly doing with this new study, saying, well, here are all the health foods. And they left out a lot of things that I consider health foods. Where's the butter? Where is the coconut oil? Where is red meat? All of those things are considered health food to me. Where's the bone broth? Health food. Not on their list of health food. They're going to help subsidize the bone broth? Keto Bob's, I'm a public school administrator and I can't believe the food that we feed kids. And yeah, I used to be a substitute teacher in my local school district back in the day. And I was shocked when I found out that they only get about $2 to provide school lunch to these kids. $2. $2, you can't even buy like good quality mystery meat for $2 per kid. And this is why I like some of the innovation that's happening with some of the schools where they're growing their own garden and they're teaching the kids about real whole foods again. But yeah, it's an uphill battle. I definitely feel for you as a public school administrator because what do you do? What do you do? And here's the other thing. You're a public school administrator whose school lunches and school breakfast, they have to follow what the dietary guidelines say is healthy. So I remember some of the people talking about how they had to put some kind of a whole grain on the plate and they couldn't omit the whole grain. Oh, it's part of the guidelines, so it mandates what happens on that school lunch plate. This is the problem with these guidelines. People are like, oh, just ignore the guidelines. You can't ignore them if they become the template for where school lunches go, what it looks like on a plate. Alberto says, I also think they're trying to promote low-fat milk as good because they don't want to throw away the milk residue after making butter with it. Yeah, that's true. Because when you make butter, you strip all the milk solids out of there and all the good healthy fats out of there. All right, who wants to buy this crap? It's just white water basically at this point. Anybody? Oh, I know. Let's tell the idiots out there that it's health food. Let's call it skim milk because we skimmed off the bad part and we left behind the great part. And yes, it tastes like white water, but shh, it's health food. Tell them it's healthy and they'll pay more for it. You think I'm kidding? That's what happens. How has carnivore impacted your insulin? Well, I'm not doing carnivore. I'm doing keto carnivore. Are you still wearing a glucose monitor? So the glucose monitors only go in your arm for about 10 to 12 days. So I don't constantly wear the glucose monitor, but wear it on occasion, called Freestyle Libre. Carnivore, I haven't tested my insulin since earlier in the year. I'll probably be doing some more tests here later in the year. But that's one of the goals of this. But I don't think keto carnivore alone is going to bring that insulin down. It's going to take that 6-month sabbatical, which starts for me September the 1st, and getting away from kind of the day-to-day stresses of the work that I do for that to truly come down. Colin says, but the people that follow those guidelines are probably healthy anyways. The obese are following a horrible diet, following no guidelines. Exactly. They're not following the guidelines for the most part. AK Bonbon been keto for a year. Does that qualify as sustainable? I sure think it does. Absolutely it does. Yes, Kimberly, yes, you had to come over to Instagram. I got kicked off of the internet because of the storms that we're having here. So I have a Wi-Fi only iPad over here that I usually do Facebook Live. So when the internet got knocked out, The only internet I had was the LTE on my iPhone. So, yeah, sorry about that if you were watching on Facebook, but you're here now. Government messed me and my family up with the sad pyramid, says Tammy. Not going to ever go by their guidelines again. Everyone needs to educate themselves on what works for them. Yep. Beth says, it's like a Dr. Oz article. Give people just enough info to be dangerous. Don't specify what kinds of fruits and vegetables. Don't tell them the dangers of inflammatory oils. And I'll go one step further, Beth. Don't tell them that red meat is health food. Because nowhere in this list of healthy eating plan, healthy foods, did they even list red meat. Now, to their credit, they didn't say limit red meat. They just said limit sugar, salt, and fat. So I suppose red meat, by extension, could be included in the fat category. But yeah, they want to have this perception of what healthy food is, and I ain't buying it anymore. Beth says they won't subsidize bone broth. They'll merely remove your gallbladder and lock up ox bile or sell it for $3 gazillion a carton. Yeah, yeah. Christine had her gallbladder taken out because of all those low-fat diets she did for so long, and people don't think about it. If you don't eat fat, what's the need for a gallbladder? All that bile will start to sludge up, and that's when people start having issues. All right, so Keto Bobs, we're not taking like specific general questions, and that is a very general question that's very interesting. Not right now anyway. Typically, I do general questions once a week. With the weather today, guys, I'm not sure if I'm going to be able to get in my weekly Friday afternoon Q&A. Maybe I'll do it over the weekend sometime, but if I can get it in a little bit later, Keto Bobs, definitely ask me about that. Because that's a perfect question for the Q&A session time. But guys, thanks for coming back on this Jamie Rants. So subsidizing healthy food can indeed improve health. There's no denying it. If we subsidized healthy food, people would see marked improvements in their health. The problem is, how do you define what healthy food is? And how do you determine what's going to be healthy for one person may not be healthy for another person, and vice versa. So Elizabeth, that's another question. That's a general question that doesn't relate to what we're talking about here today. Definitely keep that in mind when I do my open Q&A. If I can do it a little bit later this afternoon, you guys, I will come back on and do my open Q&A late this afternoon. But thanks for being here on this episode of Jimmy Rants. JimmyRants.com is the website. As always, engage live right here on Instagram. I'm at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you're there, you can engage live in the content. But if you missed the live, you can actually watch it on replay for up to 24 hours on Instagram. After 24 hours, it does disappear, so be sure to pop on over to YouTube. Type in a keyword Jimmy Rants, either in a YouTube or a Google search. You will find the show. Also, youtube.com/LivinLowCarbMan. Finally, the best of the best moments of this here show are in podcast form. It's the Jimmy Rants podcast on Apple Podcasts as well as Stitcher. All of these links, you guys, are at JimmyRants.com. So until next time, we'll see you then.